Well, it's the tail end of our show, which means one thing. It's time for our tail end feature of the week. Several months ago, my furry friend Bucca here hurt her right rear leg while herding the horses. Well, after several vet visits and many days wondering what was the right treatment choice, we decided to take her to see the experts who specialize in sports medicine and dogs. Meet Bucca. She's 6 years old, full of energy, and simply loves life. That's why when my furry friend suddenly started having a hard time walking, I took her for a second opinion with one of the top centers when it comes to orthopedic surgery and rehabilitation.
The whole center here, from the hydro to the minimally invasive surgery, digital radiography, the gait analysis, is all based around the human model for sports medicines.
From ground level weight scales to no stainless steel tables, and get a load of this, even rubberized floors for sure footing. This 16,000 square foot facility in Annapolis Junction, Maryland is quite impressive.
Hi,
Hey,
Dr. Marie.
Dr. Knapp,
Dr.
nice
Knapp,
to meet
great
you.
to meet you.
And
Thanks
this
for
is
coming in.
Bucca.
Hello, Bucca.
Yeah, Doc, I appreciate you squeezing us in today. Like I said, she's been having a lot of issues with that right rear leg, and it's not getting any better.
And did you see the event happen? Was she out running in the pasture?
I was
or what
actually cutting the back pasture, and she ran past me, and all of a sudden when I saw her come back over the hill, which was within what, not even a minute, her right rear leg was cocked up. Curious to see what the general veterinarian that first examined Bucca was calling everything from osteoarthritis to possibly cancer, I brought Bucca's x-rays with us to see what was really going on.
No signs of osteoarthritis in this knee, no signs of neoplasia or cancer anywhere, but that's just a little bit of shadowing. Very clean. So.
Why people should always get a second opinion, right?
I agree. Second opinions are important. People do them, everyone themselves personally, should get one as well. Your children, I would take my child to a second opinion as well. It's also why you seek out a specialist.
Come on, Bucca, walk. First test, a gait analysis to get a good baseline of the extent of Bucca's injury.
The important one for us right now is going to be pressure. How much pressure, how much weight are we actually putting on that leg? Look at that, 22 versus 42. So not bearing a whole lot of weight on that hind limb in the right.
The slight motion seen with his tibial thrust test means Bucca may have blown out her cranial cruciate ligament in her knee. Next step, more in-depth x-rays.
So your dog's a rock star orthopedically. The issue is that we've injured her knee.
When it comes to treatment options for a torn cranial cruciate ligament, a custom molded brace is economical and a good choice for senior dogs or dogs with medical issues.
It does take time. They have to adapt to this product or to these devices. So we have therapists here that will actually do rehabilitation therapy with the dog as they're learning to work with the actual device.
I can't see my dog living like that.
No, but some dogs don't have an option.
Since Bucca is young, healthy, and has many squirrels to chase in life, she's booked for surgery next week.
We're going to try to do something to keep this femur from shifting down the back of the tibia.
And when it comes to complete canine health care,
I'm going to focus my light therapy there.
you have to love this center's motto.
Live better, feel better, play better. I developed that when we first started, about 5 or 6 years ago. I thought that was awesome. It fit the whole entire picture.
We'll be following Bucca's progress over the next several months. For more information about any of the segments you saw on this week's show, log on to our website, yourlifetv.com. Remember, it's your life, live it well. We'll see you next week. Right, Bucca? High five, Fachi, high five.